Hello and welcome to this edition of Consider This. Today's episode is on Medicare. Who pays for it? And does your employer pay for it? We're going to go into all of this. Okay? So let's go over to this is a new way I'm starting to do my shows because I'm showing you the website that I put up, which has all the documentation to it. And I have been using Google AI Gemini, and let's bring that up. And it has been pretty good. It's not bad. It brings up some stuff that I wouldn't think to go and research. So we get the full scope of this. And I do this because I was poisoned back in 1992 and I haven't been able to work since. And I feel that there are a lot of people out there that are being abused and misled like I have been over the years. Everybody tells me, well, you look too good, you can't be sick, and this, that, and the other thing. Never mind, I've had strokes and heart attacks and cancer and a lot of other things. So let's get into this. Okay, you pay 1.45% out of your pay, just like Social Security. It automatic Social Security, if you're an employee, they take 6.2% of your pay for Social Security, and they take 1.45% of your pay for Medicare. So you pay for Medicare. There are certain things I would like to see changed, which would make Medicare better, and we would be able to have Medicare for all, which would eliminate Medicaid. Because if everybody has Medicare, you do away with the Medicaid, and we take care of everybody's needs. And this explains to you that Part A is funded heavily in payroll taxes. Part B is funded with premiums and general revenues, and this is so it all comes from our taxes, and I find it really ironic that we send $350 billion to Israel so they can have socialized medicine, yet we don't have it. And it's ridiculous. But so 1.49% comes out of your pay, and your employer pays 1.49%. 1.49%. So, if you want to go through these, like I said, you can. I've changed up my website. We can go back to the website and we can go into it. If you go to my regular website, comfortandcolor.com, click on the truck, and you come to my education page, and this has a lot of information. It has medical studies, it has plastics in the human body. There's a lot of that since 2022, and then there's the gastrointestinal and everything, that the child data. There's quite a bit, but if you click on either one of these, it'll take you to this page here, which is my YouTube page. To go to the YouTube channel and you don't care about this, you can click here. You see all the old shows I did when I was living in New York, and there's no like, we'll click on this one here, Social Security. It'll come up. It gives you, please, if you consider donating to support our work, here's your link to the show, and these are all the things I use to do the show, so, okay. So we're going to get back to Medicare. And so I use Google. It comes up with everything you need. Medicare and Social Security funding. So it tells you everything. The one thing I really want to stress here is with Medicare, there is no limit. With Social Security, there's a limit. And right now in 2025, the limit is $176,100. If you make under that amount, you pay Social Security tax year round. If you make more than that amount, you only have to pay up to that amount, and then you don't have to pay Social Security tax no more. So if you make $1 million, your Social Security tax ends in February 3rd. That's unlike Medicare. Medicare, don't care how much you make. You still pay 1.45% of your pay towards Medicare. So everybody should be covered under Medicare with the money that's going into Medicare. So Medicare is paid for. Social Security is basically paid for by the working person, not the CEOs. And that's the problem I have with Medicare. The rich should pay their fair share. They get the majority of the money because they say, well, we made millions of dollars and we should get more than them because they didn't make that much. We have to do away with that. Tax them. They want to close it down? Tax them. Make them pay their fair share. After all, a poor person pays all the time, where the rich, and all they do is cry about, oh my God, my money, my money, my money. That's greed. And if you're a Christian, which I am not, I'm not a Christian. I went down that road and found it wasn't for me. So I look at things a little bit different, and I'm not sure, but this here explains a lot to you, and I'm not going to read anything. I have dyslexia, which I explained in all my shows, and I put this stuff out here, and I had a lot of people tell me, well, why don't you put your data into it? So, and some of this won't come up on your computer as fast as it comes to mine, because this here, I'm making the video now, so it's not up yet. So everything's coming off my computer. So when I click on these things, they pop up real quick, which you have to download them. So, all right. So this is another page that I thought was pretty good. And I should start highlighting, and maybe I'll do that next show, next episode on whatever I'm doing. So I thought this here would be really good for some of the information it explains, and a lot of it's redundant, and it just tells you the same thing. And you know, and this here tells you your prescriptions, what you pay for it, and I think the prescription should be paid for, especially for people that are disabled. I worked almost 18 years as an over-the-road truck driver. So I am not a doctor. I am not, I was poisoned, and I want to know what's in store for my life coming up. So I do a lot of research on how these chemicals are affecting me. Like, I have asbestosis, so I know that it's going to get worse and worse, but I want to know what's going to happen. I've also had thyroid cancer, where they took my thyroid out with 4 different kinds of cancer. They check me about once a year to see if I have cancer again, because 2 of the cancers weren't supposed to be in the thyroid. So, yeah. So this explains how much you pay, when you pay, so forth and so on. Head of household. And this is a form for your monthly income, and so forth and so on. But this is where I have a problem with it. Because companies like the made a mistake here. This 5 should. I don't know how that got in there, but anyway, PSOA. These chemicals. There's like 400 different chemicals listed under PSOA, and PFOS, PFOF. There's so many of them. They are what they call forever chemicals, and everybody's been exposed to them in the world. And the companies are now saying, especially companies in the United States, are saying that it's too expensive for them to clean up the mess that they made, and they can't put the genie back in the bottle. So it's up to the American people to do it. Well, if it's up to the American people to do it, when they're getting all these health effects, kidney cancer, testicular cancer, other cancers, prostate, breast, liver, thyroid, have been observed. And like I say, this stuff's all over the place. It's in some of it's in plastic, some of it's in, and you got BPA, which is another chemical. You got styrene, which is another, and they're all over the place because we use it so much. Styrene's in the air. This stuff's in the air. BPA is in our food containers. This stuff is all over the place. So these industries should be putting another, instead of just 1.49, they should be putting 3% of, they should cover the 1.49 and put another 1.49 or 1 point whatever to make it 3%. And Medicare should be for everybody, because these corporations, oil companies, the whole line of it, anything that has to do with industrial chemicals, you should have to pay. And there's going to be a lot of pushback against this, because these corporations, they're in it for the money. They want to pay their CEOs 20 and 40 and 50 million dollars a year. Um, so when you get hurt, like I was 38 years old. 38 years old when I was poisoned. I am now going to be 70 in a few months. So I've been out of work longer than I worked. And if we keep doing this, it's going to bankrupt, especially with the Trump administration in there, cutting away all the safety measures that we had. It's just diabolical. So they should be putting in twice as much as the employee, not the employer, the employee, so that we have enough money to care for our children. Everybody should have Medicare. That's it. Do away with the insurance companies. We don't need an insurance company CEO and the rest, it's COC or whatever titles they have, making $20 million while they're not paying for us to go to a doctor's appointment or to a hospital when we need to go. That should be done away with. It would eliminate Medicare, so the states wouldn't have to put money in with the federal government to pay for people that are sick, that are poor. Everything would be taken care of in Medicare. It would save so much. It would cost the corporations a little more, but if they're paying their CEOs and everything millions of dollars, for what? To poison us? To go to hire people to go to Congress and tell them that, the American people's got to clean this up. We can't clean this up. This is diabolical. And it's the same with the Social Security. They call it a Ponzi scheme because, and meanwhile, because we're only taxing the poor the most because they don't make that much money, so they've got to be taxed more than the rich. Yeah, the rich pays a few dollars more, but they've got 10, 20, 30, 40, maybe even 100, 200 times more money than the guy that's working at your grocery store. You know, this is ridiculous. Social Security, you should be able to get at least a living wage where you pay your rent, your groceries. You know, the rich keep, SNAP. You don't deserve food stamps. You don't deserve this. You don't deserve that. And it's only because the rich own the corporations. They set the wages. They set the rules and regulations for the company, whether or not it abides by the laws of the state or the federal laws, until they get caught. And then they pay a minuscule fine, and that's it. So I went off on a little tangent there, and I apologize, but people have to hear that. So, you know, and this here, I left some of these in here, and these are clickable. So you can click on it, and it will take you to the EPA site, so you can get more information there. All right. So, and all this, and when this video's finished, I'll post it, and I will put the link here. But Medicare is paid for by our taxes, 1.45% of your income. So the federal government altogether takes 7.9% of your pay for Social Security and Medicare, and yet most people are living below the poverty line because Social Security is based on workers, low income workers, more than the rich. I think we should tax everybody 6.2% of their pay for Social Security. But seeing that we're not there yet, I proposed in episode 12, I proposed that they bump it, the Democrats want to bump it to 400,000. I say bump it to $1 million. So you got to pay into $1 million. And if you go to my episode 12, right here, and go into the documentation and view it, you will see that the average CEO, low rate CEO, makes about $850,000 a year, up to $20 million a year, and the upper guys forget about it, But it's more money than 100 families need to survive, and they're so it just makes me so upset. I mean, so this is my show on Medicare. I hope you subscribe, like us. If you consider that you got help from us, consider donating. I do this on my Social Security. I get when I first, in 1992, I got $590 a month, and it's all in my episode 12. And I was making $90,000, between $85,000 and $90,000 a year. And when I got hurt, I figured I'd be getting a living wage. I still had 4 children home, and I was paying child support. And I went from $85,000 to $90,000 a year to $590 a month. Hell of a pay cut. But we're here now, and my kids have all survived. They're all over our nation, and I figured, seeing that I can't get no work, I would try to explain things to people. And here I am running on. I thank you for listening. I hope this has helped you a bit. And please, at least subscribe and like. Thank you for listening. Have a good day. Bye.